Which is the symptom that differentiate classical migraine to common migraine? Options are nausea, headache, photophobia, and scintillating scotoma. Answer of this question is oral symptom that is common in classical migraine, that is scintillating scotoma. That is in an area that is partial alteration in the field of vision that flickers with zigzagging line that resemble fortification or wall of the castle. Migraine is characterized by recurrent, often unilateral, moderate to severe headache, which may be associated with the number of symptoms that is attributable to the autonomic nervous system. Headache in migraine usually pulsatile or throbbing, that is severe enough to force the sufferer to the going to the bed or in the darkened or quiet area, and this pain is aggravated by physical activity, sensory stimulation, sleep deprivation, and this pain may be last up to 2 to 72 hours. Migraine is divided into two parts. One is classical migraine, another is common migraine. In classical migraine, there is associated autonomic dysfunction with prodromal aura. Like there is transient visual loss, olfactory deficit, sensory deficit, or motor disturbances like pin in needles and numbness. And there is symptom like nausea, vomiting, photophobia, and phonophobia. These symptoms may be common in both classical and common migraine. In common migraine, sufferer experience the same throbbing pain, nausea, phonophobia, photophobia, but there are no prodromal symptoms and there is no autonomic dysfunction. Migraine previously thought as a disorder of the neurovascular system, but nowadays this is considered as a disorder of brain itself, in which there is cortical spreading depression wave is there. That wave of depolarization start in the occipital lobe that propagate through the brain and followed into suppress activity of the brain. Subsequent activation of trigeminal vascular system causes the release of neuropeptides like calcitonin, related peptide substance P in the peripheral trigeminal nerve ending. And this neuropeptide are thought to play a role in the causing and maintaining the headache. This condition run in families approximately two-thirds of the cases and three times common in women than the men, and peak of presentation about 30 to 40 years of age. Trigger factor are stress, hunger, fatigue, hormonal changes, some food stuff like tyramine, cheese, fish, meats, and some type of the beer. So these are the trigger factors. Migraine is a clinical diagnosis, even though you have to rule out any intracranial lesion by doing MRI. So, if recurrent cases are there, you should rule out any intracranial pathology by doing MRI. The protocol of migraine treatment, three protocols are there. First is avoidance of the trigger factor, second is acute symptomatic control, and third one is pharmacological prevention of the migraine. Five important things in the migraine management. First is healthy food, that is very important. You should take early morning heavy food, and that is healthy, and there is no beverage or alcohol intake in the migraine patient. Second important thing is the sleep. You should take at least 6 to 8 hour proper sleep, and that is sound and peaceful sleep should be there. And third important thing is the stress and tension. So you should not take any stress or tension in the life, and it is very important in the migraine cases. So your will should be free will in the life. Live life happy and enjoyable. Fourth important thing is the meditation and yoga. You should do at least 10 to 20 minute meditation and yoga early in the morning in oxygenated area. And fifth important thing is you should avoid heavy sunlight area in the daytime, or you should avoid loud noise area. So you should not go in noisy area. Now acute symptomatic control. So commonly used medication are non-steroidal anti-inflammatory drug, mainly combination of acetaminophen, acetyl salicylic acid and caffeine. So caffeine is also helpful, like you should take coffee. Triptan medication can be added if migraine is moderate to severe, like sumatriptan, naratriptan, rizatriptan, zolmatriptan. But these medicine having side effect like flushing, and these drugs are not recommended for the cardiovascular patients. Other medications are ergotamine and dihydroergotamine. They are also effective in moderate to severe migraine that can be added with the NSAIDs. Preventive measures in migraine include medications, nutritional supplements, and lifestyle alterations. Prevention is recommended in those cases who having headache more than 2 days in a week, cannot tolerate the medication used for the treat acute attacks, and those with severe attacks that are not controlled. Options of medication are anti-epileptic drugs, topiramate, sodium valproate, beta blockers, propranolol, metoprolol, beta adrenergic receptor antagonist like timolol, and antidepressant medication like amitriptyline and venlafaxine. These are the drugs used for the preventive medication in the migraine. Botulinum toxin type A can be given in intramuscular multiple site, about 30 to 40 sites in the head and neck, to control or preventive of the migraine attacks.